It's an early start at this South Texas high school. Hundreds line up outside, but they're not here for class. Indeed, many camped out overnight. Those who get in can be seen by a doctor and pay nothing. No questions asked, no identification required. Technically, this is an emergency preparedness exercise. State officials say the free medical care is a perk.
We do know that there are areas here that, we might have people that may not be able to afford to go to a doctor, and so they take advantage of Operation Lone Star to do that.
The Texas State Guard takes the lead, just as it would in any disaster, natural or man-made.
I've had friends and brothers die in this uniform and bleed in this uniform, so I hold it to the highest standard as possible. And the fact that I could serve my fellow Texans, it's the greatest feeling in the world.
Almost no one working here is getting paid.
Hey, lift your chin up.
That includes Junior Osinde.
You're not going to take money to your grave, so I wanted to give back.
The 28-year-old dentist shut down his private practice for a week so he could be here.
There are government facilities for dental that is like low cost to some patients, but a lot of patients can't go to those areas because it's like very remote areas. If you don't have money, you don't have transportation to get to the location where they serve you.
Which is where Remote Area Medical, or RAM, gets involved. Each year, the Tennessee-based traveling nonprofit leads or partners in more than 100 clinics across the United States.
We're providing medical care for folks who can't afford medical care or can't afford medications to control some of their medical problems and who are in need, who are suffering.
Many of the patients here are uninsured, and those who have insurance say it isn't enough.
Thank you so much. I appreciate it.
Rhonda Schwartzbach came for glasses. She says the insurance she gets through her husband's employer doesn't cover them. For her teeth, she says, she crosses the border to Mexico.
I have dental insurance. It's still cheaper going across there. And they've got great dentists over there. I mean, and it's like, it's almost a fourth of the price of what I would pay after my insurance kicks in.
One of the unique things about this operation is this mobile optical lab that travels across the country. Here they can make customized lenses, which means people can leave with brand new glasses, and for some, that can mean the difference between night and day.
We had a young boy come through with his grandpa. I realized he couldn't see the writing on the wall across the hall from us. We got the boy glasses and his face lit up because he had never seen birds in the trees. He'd always heard them, but he never realized what birds in the trees looked like.
For some, this was no drill. Roe Ruttenberg, CGTN, in San Juan, Texas.